Welcome to your Aged Care Compass podcast. Join us to find out how to support your older loved ones at home. We're going to help you make sense of Australia's aged care system. We talk about legal and financial considerations for ageing and how chronic health conditions impact your older loved ones' well-being. And we share real-life stories of where it went wrong for people and how we got them back on track.
Welcome to episode 8 of your Aged Care Compass podcast. Today, we'll be talking about how to prepare for assessments. It doesn't matter which team you are being assessed by, it is still important that you understand what information you need to get across to be approved for the level of care that is appropriate for your or your loved one's needs. Coral, what are the key points we'll be discussing today?
Shell, we'll be discussing screening versus assessment. We'll be talking about what assessors are actually looking for when they're doing their assessments, and we'll be also including your ability to offer input during an assessment.
Okay. Now, I know we say this in almost every podcast, but I'm going to ask you again. Does My Aged Care assess?
No. My Aged Care, the gateway to all these government subsidised services, does not assess. My Aged Care screens people, and then My Aged Care, on completion of that screening, they decide where your referral will go to which assessment team. It might be the entry-level team, the Regional Assessment Service, or it might be the Aged Care Assessment Team or the ACAT. It's really important for people to understand the difference between the screening and assessment. If people ring up My Aged Care thinking that their loved one's needs are potentially sitting at an ACAT level, they can't ask My Aged Care to give them an ACAT assessment. During that screening process, depending on how detailed and compelling the information is that you get across to My Aged Care, they then determine whether your referral will go to the RAS or the ACAT. But if you do get enough information across at that point, reflecting the needs of your older loved one, it is possible to sort of bypass that entry level and go straight to the ACAT for an assessment. But it does come back to you providing as much detail to My Aged Care so that whilst they're screening, they then form a very clear picture of what your loved one's needs are and which is the appropriate team to refer your loved one to.
Right. And so when it comes to the assessment, what are the assessment teams looking for?
So assessors are looking at a complete picture of the older person. They're looking at what they can and can't do for themselves, how much family support is being provided, what health conditions are impacting on the older person being able to complete their daily tasks independently. Is the support that carers are providing so high that it's taking a toll on the carer, making that caring situation unsustainable? So specifically, assessors are looking at like a functional profile of people, which is reflects the person's ability to complete what we call the activities of daily living with some support or a lot of support or no support. And this also includes mobility and falls. Assessors are also looking at cognitive presentation. So if the older person is beginning to experience some issues with their memory, or perhaps they do have a diagnosis of dementia, they'll be looking at how significant that cognitive impairment is. They'll also be looking at impaired mood, notably depression at this point, because if an older person looks like they have some emerging cognitive or memory issues, at those early stages, it can actually look like, a mood disorder like depression as well. So assessors, particularly the ACATs, because their clinicians will be teasing this out a little bit more. And the other thing they will be looking for is carer sustainability, which reflects what I just touched on about that level of carer burden or carer stress. So a very important point to get across when you're being assessed by the RAS or the ACAT is all that support that you're providing as a carer, is it starting to take a toll on you? And sometimes, particularly at entry level, this discussion doesn't always, and that's why people need to go on the front foot. That's what we always say, give as much information as possible and talk about the toll that it's taking you, because this is really important as you progress through the aged care system, is your ability to continue that ongoing care of your older loved one.
Yep.
Now, if you're able to get any clinical assessments along the way, if there's currently a physiotherapist or an occupational therapist or speech pathology, nursing, any kind of clinical assessments that may have been done already, it's really beneficial to getting a copy of those reports and showing them to both the RAS and the ACAT assessors, because that adds weight to the information that you're imparting during that assessment process.
And who are the assessment teams, Coral?
So at entry level, the regional assessment service are typically a non-clinical workforce. Now, there are some RAS assessors around the country who do have clinicians on their teams, but on the whole, they tend to be non-clinicians. So more like administrative kind of staff. These RAS assessors work for a number of large organisations across the country, and it varies from state to state. The RAS approved for services and support at entry level, and these services that they're approving for are being funded under the Commonwealth Home Support Program. Then there's the ACATs, the Aged Care Assessment Teams, or if you're living in Victoria, these will be the Aged Care Assessment Service, or the ACAS. So ACATs are all clinicians right across the country, and typically they consist of nurses, physiotherapists, occupational therapists, and social workers.
Yep.
When you get your ACAT assessment, it makes no difference as to which discipline that clinician aligns with, whether it's a social worker or a nurse or a physiotherapist. The ACATs all assess the same way. So there's no advantage or disadvantage whether you get an ACAT social worker or an ACAT nurse. The assessment is going to be the same.
FlexiCare is a not-for-profit organisation which supports older people living in Brisbane's southern suburbs to live their best lives in their own homes and communities. FlexiCare don't have grand plans to be the biggest aged care provider. They want to be known for treating each one of their participants as an individual who they get to know well. They answer their phone calls personally when clients ring them. They give their clients easy access to a home care partner who can work with them to deliver the best mix of support possible. If you're in Brisbane South and want to know more, give their friendly team a call on 07 3422 8400 or check out their website flexi.org.au. What are the different programs of support that come as the result of an assessment?
So coming down from that screening from My Aged Care, who then determine which assessment team or assessment workforce you go to, only being the two, the Regional Assessment Service and the ACAT, there are two funding buckets. Well, there are three, but there are two main funding buckets. So at entry level, if you're assessed by the Regional Assessment Service, you will get approvals that are called referral codes. So these referral codes are individual codes or approvals that allow you to receive subsidised services from providers who are approved to deliver those kind of services at entry level. The funding that's aligned with entry level is called the Commonwealth Home Support Program, or CHISP is the acronym. The Commonwealth Government allocates this bucket of funding to approved CHISP providers, and then it's up to the providers to make that funding stretch as far as possible. CHISP services, entry-level services, I call these services fragmented because there could be any number of CHISP providers involved at entry level. There's not one overarching provider. So there could be 2 or 3 or 4, sometimes even more providers. So I refer to this as fragmented because there's not that sort of consolidated coordination that's happening.
Yep.
The ACATS, Aged Care Assessment Team or Services, they're assessing people for the Home Care Package program, which has its own funding stream. And then they're also assessing people for the flexible care options, which are short-term restorative care and the transition care program. The ACATS are also approving people for respite and entry into residential accommodation.
Okay. So knowing all of this now, how do people best prepare for an assessment?
Look, people need to take the time to do this because, one of the things we always say, Shell, is preparation is key. The more you prepare, the better your outcomes are going to be as you enter and move through our aged care system. So you would take some time to think about all the help that you currently need. Now, for the older person themselves, this can be a challenge. So we always encourage family members, carers, those that are involved with the older person to do this themselves or to sit down with the older person and talk about it together. So you would be reflecting on how much help the older person is receiving from family or friends or neighbours perhaps. And are they paying privately for any help at the moment? Are they paying for someone to come in and mow the lawn or to do some cleaning? You need to write down all the support that you're receiving. So, noting how many times the older person perhaps is calling family for reminders about appointments or perhaps their medication, how many days family members are visiting the older person. Are family members taking you to appointments or doing your grocery shopping or paying your bills for you? So these are typically tasks that, as the adult children of older people, we just do this. We do this every day and we don't really give it a second thought. But by reflecting upon this kind of support and writing it all down, starts to form a picture of the level of care that the older person would be sitting at. And this is all really important information. Some people actually can struggle with this a little bit because even though it's support, they don't see it as support. So the easiest way I say to people is, if you're the adult child or the spouse of the older person, remove yourself from the picture and then think about, can your older loved one get by without you? Could they actually manage day to day, week to week without you being around? And that often is a great way for people to sort of take a pause and realise actually how much support they're providing.
Yep.
Another really important point in preparing for assessments is acknowledging the toll that it's taking on you as the carer. Now, sometimes this conversation may not come up in assessments, but it's essential that it's discussed, and often it will be you driving this conversation. So we never want this conversation to be left until the carer is at breaking point, because then people's options are limited. If you're providing even a low level of support, certainly moderate level of support, you need to be talking about that, and you need to be telling the assessor that might be really hard for you, that you're raising your own kids, you're running your own business, or you're working full time, and you just cannot continue to support perhaps mum or dad as much as you'd like to. It's just not possible. Two topics that, again, sometimes don't come up. They will more typically come up in an ACAT assessment. But again, if people are entering the system at entry level, it's really important to get this information across as well, is incontinence and, as we've already touched on, cognitive impairment. So quite uncomfortable topics to talk about. But again, reflecting the level of care or the level of need that the older person has. So essential to getting this information across, don't rely on the assessor to prompt you. You need to have written this down on that list, and then you need to bring it up with the assessor.
And I guess given that, Coral, obviously the assessment's being done for the older person, but can someone else offer input?
Absolutely. And we always encourage this. You want to get a whole, a complete, a very detailed picture of what's going on in the older person's home and in their life. So during every discussion, as you enter and move through the aged care system, it's essential that you provide as much information as possible. So at initial contact with My Aged Care, who are screening you, you have to expand on the answers that My Aged Care is asking you, because they do ask a lot of questions. But if you're unaware that you need to give as much information as possible, you will miss a lot of detail. And potentially, if your loved one is sitting at ACAT level and you haven't conveyed that information, your loved one might be assessed at entry level, and they may not get the support that they need. With RAS and ACAT assessments, when they contact you to arrange an assessment date, you can actually offer information then. So particularly, again, with the ACAT, they will call you. It will be the ACAT triage person that will call you first, and they'll do their own brief screening with you. They will have read all the notes that are in My Aged Care from your previous discussion with the My Aged Care call centre staff. And then the ACAT triage, in that discussion where you're giving them all that information, they will establish how urgently they need to respond to that referral. So take this chance to tell them if it is urgent. The ACAT triage person will note that down, and what they do then is they assign that referral, your older loved one's referral, to one of their assessors, and it will be determined that does this older person need an ACAT assessment sooner rather than later? Is there more of an urgency for this person than there is for perhaps other people? Both the RAS and the ACATs are so busy that they are expected to complete their assessments very quickly. So we're hearing presently that if people try to follow up a day or two later after having an assessment, trying to offer more information that they'd perhaps forgotten during the assessment, that it's actually too late because the approvals have already been given. Now, you can certainly go back and ask for a reassessment if you think that something's being missed, but it will take many weeks, if not months, to get either the RAS or the ACAT to review their approvals that they've given you. So the key point here is to get it right in the first instance.
And Coral, it's actually quite okay to have a list, isn't it, when you go into that assessment, to make sure that everything you want to discuss is covered off?
It's essential. It's essential, Shell, to have a list. Having a list means that you are prepared, and you definitely need to be prepared as you enter, and then as you move through the system at every stage, at RAS assessment, at ACAT assessment. Like I've already said, the outcomes that you get really reflect on how much detail you've gotten across at every step. So if our aged care system did what it should do and was able to establish people's needs quite accurately, then we wouldn't be here speaking about this. But the system just doesn't. And so it really comes back to you as the individual taking the reins and driving these conversations and getting all that really important information across at every conversation. And you do that because you have your list next to you. And so when you get that phone call from the RAS or the ACAT, you're ready to go. You know exactly what you need to say.
Excellent. Oh, great information there, Coral. I think that will do for today's podcast, and looking forward to speaking with all of you again next week. Hey, Care community. Thanks for listening to this episode. So you never miss a show, make sure you subscribe to our podcast. If you'd like to know more about what we do, head to our website, cmeacn.com.au.